I was at North Tees Hospital with Amanda, who runs the NHS, and other colleagues to launch our plan to cut waiting times in urgent and emergency care, something that we've been working on for a little bit. Now, I don't need to tell all of you about some of the challenges that we're all experiencing in our emergency departments at the moment. Now, there's a lot of reasons for that. We're still recovering from the impact of COVID. We've had, I think, the worst flu season, Amanda will correct me, in about a decade, so it's been pretty tough for everyone, and we've still got far too many people in hospitals who we would much prefer, and they would prefer, to be back home in their communities being looked after. But look, we're not alone in facing these challenges. You can see similar things in Wales, in Scotland, even internationally, in Canada, in Italy, and Germany. They're all people grappling with similar challenges. But we still need to do something about it. And that's why last year, when the Chancellor stood up and announced what's called the Autumn Statement, we had to make some difficult decisions. I think you all remember what happened, and we had to do some things to get our debt and borrowing under control. In spite of all of that, we prioritised the NHS and social care with billions of pounds of extra funding, because I know it's your priority, it's my priority, and the government's priority too. But the question is, and what you want to ask me is, well, how are you going to spend that money so it actually makes a difference? Because we need to improve this. And today's plan does that, I believe. There's 5 very specific things we're doing. The first is more capacity. That means 5,000 more beds, 800 more ambulances, 100 more mental health ambulances, just to put more capacity into the system. The second thing is to increase the workforce, making sure that we've got more doctors, more nurses, more types of all professional, actually, and many of you that I've met this morning are going to be here and help us deliver on that, and we want to support you to work as flexibly as possible when you get there. The third thing was discharge. I mentioned we've got 14,000 people in hospitals at the moment who ought to be either back home or in their communities, and that's causing some of the challenges that we're seeing in our hospitals at the moment. So we've got a plan to speed discharge with particular money and some initiatives to help there. The fourth thing is having more people cared outside of hospital. I think most people don't need to be in hospital, they don't want to be in hospital, and there are some great examples where we can treat people with respiratory conditions in virtual wards, or indeed new frailty and fall services, again keeping people out of hospital, so we're going to do far more of those. And lastly, we're going to improve 111, and we're going to put different types of people into the 111 service so people can get the help that they need on the phone and hopefully end up not needing to go to A&E in the first place. So those are the 5 points of the plan, and all of that is going to have an enormous amount of support to help those trusts that need extra help. Now, I was with Kath and her team this morning at North Tees. North Tees is an example of somewhere that is doing brilliantly. Thanks to the incredible joined-up working between all the different people at North Tees, they've really figured out how to attack this problem and make an enormous difference to so many people's lives. And what we need to make sure is that we spread that kind of best practice out and about across the country, and that's what Amanda and I and the Health Secretary were talking to the team at North Tees about this morning. So that, in a nutshell, is the plan, with more beds, more ambulances, more staff, better social care. And if we can deliver on it, then I think we will see, in fact I know we will see, the largest and fastest ever improvement in emergency waiting times in the NHS's history. That is the ambition of our plan that we've set out today, and partly because of all the time I've spent with brilliant people like Kath and her team this morning, all of you who are training, I feel really confident that we can deliver it. Because ultimately, it's because of all of you and the hard work and the ingenuity that you bring to your jobs day in, day out, that we're going to fix this problem, we're going to improve things for patients and make an enormous difference to people up and down the country. So thank you for your help in making that a reality. Thank you for being here today.